My first guest is Congresswoman Nanette Barragán of California. She is the chair of the Congressional Hispanic Caucus and the co-sponsor of the Access to Innovative Treatments Act. Welcome, Congresswoman.
Thank you for having me.
I want to first start with a little news of the day. As you know, we are in the final hours of Title 42. Republicans have been very critical of President Biden's handling of the border. Are you satisfied with what the president has done? Are you concerned about what's going on at the border?
Well, the president is creating additional legal pathways to citizenship. I think those are good things. I think they're having more resources down at the southern border. They're going to need those resources so that people can be processed. But look, it's been long overdue time that we honor our asylum laws, and that is making sure people have the ability to come to a port of entry and to apply for asylum. So there's a lot that we need to do, and it's going to be something that we're gonna see how it goes and continue to see how Congress can continue to support.
Like so many others, Congresswoman, you have a connection to Alzheimer's. Your mother has late-stage Alzheimer's. Can you describe that difficult process and what you've learned from it about the United States healthcare system?
Well, yeah, my mom's 82. She has Alzheimer's, and she is in a later stage. So for her, it's been a real challenge. The first and the biggest challenge I think I have is with caregivers. It's the inability to have access to culturally competent caregivers. My mom's a Spanish speaker. So to get somebody who can speak Spanish, who's consistently, coming and showing up. And then it's, asking the doctor, isn't there anything we can do? Isn't there a medication we can give her? That frustration as well of not having something that could slow it down even more. She takes something now. Of course, we have been told because of the stage she's in, it's just not the same as if she were able to get something earlier on. So I think there's, the ability to access to drugs. Certainly, the lack of investment, or maybe it's the way I should put it is to advocate for further investments into research as well. But it's been a challenge. And of course, there's the unexpected on what you don't know and how to handle things and learning as you go.
How can we bridge disparity gaps? Because some studies do show that Latino Americans are less likely to be properly diagnosed. Have you talked to people about that issue?
Yeah, actually, I remember with my own mom, when I thought and was noticing, that she wasn't remembering things or she was having an issue, I went to a doctor and I said, isn't there something we can do? And the problem is, I think they just say, oh, well, that's old age. Or they start doing a test on you that is for people who are so far along. And they'll say, well, do you remember how you got dressed this morning? And so I think it was our lack of understanding about the disease, the education, I think is problem number one, and making sure that we educate communities on the signs, what people should be asking, maybe if they have a similar experience of mine of knowing what kind of a test to ask for. And so a lot of that is going to be targeted outreach to underrepresented populations, and making sure that they also have ability to join clinical trials. Sometimes they're working two jobs. Sometimes they don't have the time to go and travel if they don't have transportation, for example. So there's a lot of things I think we need to do to make sure that we're closing that gap. And one of them is making sure that they have equal access to medication and treatments when they become available, and not having there be a bias in only those who can afford to get it. And I think that's what's been the impetus of my leading efforts on recently as a result of the CMS decision that I think was incorrect and wrong.
And I wanted to talk about that. I mean, a lot of people have complained about CMS and that decision. Do you think they're going to reverse course because now they're under a lot of bipartisan pressure?
Well, that is my hope. I have been on this for a year. When it happened, I spoke out about it in committee, and then I set up a call with the administrator. But we haven't seen the movement yet. And just even recently in committee, we haven't seen that movement. Even though we're seeing more positive data, more results coming out, there hasn't been any movement. And that is a great concern, because you have people who have Medicare who cannot afford this drug if CMS doesn't cover it. and they're being left behind. And to say, well, as long as you join a clinical trial is not sufficient because it was FDA approved. And this is the first drug that has ever been FDA approved where CMS has refused to cover it. And so we need to continue to keep up the good data, but we need to keep up the pressure because the more and more I hear from people, they don't understand how it's so broken, how the FDA can approve it, but CMS say, but we're not going to cover it. It's not reasonably necessary.
Well, we have an audience question, and you mentioned the CMS issue, and it's really teased it up. This is from James Taylor. He's a CEO, Voices of Alzheimer's. How can we clear up CMS Administrators Chiquita Brooks-LaSure's confusing recent testimony in front of the House committee? You mentioned that you've pressed CMS, you've called CMS. Have you gotten some clear answers?
Well, we're calling for a second meeting to follow up with them. And I don't have a clear answer because the only answer we got that was clear, she says, when it's fully approved, everybody would be covered. But, you know, the confusion, one of the confusions was, well, it was covered under accelerated approval, and our understanding is that is full approval, and that should be the equivalent of full approval, and therefore should be covered. Of course, the other part was her comment about folks being covered when it's fully approved, but then mentioning a registry. And so that's concerning, and so we do need to get some clarity, and that's part of what my follow-up request for a meeting will also cover.
You've introduced the Access to Innovative Treatments Act. This is a bipartisan piece of legislation. Can you tell us a little bit about it and its prospects of getting through this Congress?
So I teamed up with Representative Joyce up from Pennsylvania on this bill because this, as you mentioned, is a bipartisan issue. Alzheimer is not a Democratic issue. It's not a Republican issue. And this is something that affects millions of Americans. What the bill is intended to do is to try to prevent what's happening now from happening again. Number one, it prevents CMS from being able to restrict an entire class of drugs like they did in this instance. And so that should never happen again. And that's the first thing it would do. Number two, what it does, it creates a 90-day timeline for CMS to formally reconsider a drug for any drug, reconsider the coverage for any drug, including Alzheimer's drugs, when enough data is collected on the drug's effectiveness. And it really requires CMS to review coverage for drugs individually rather than the entire class. So those are the two main pillars of what it does, and what we are hoping through this legislation it will do is it will improve access to new treatments individually and make sure they're determined individually so they can be covered by Medicare, or like in this case where maybe they don't approve the first drug, you have a new drug coming out, new data, new information that is assessed on its own instead of being lumped into the first denial, which is what's happening now. And that's a real problem. So we're hoping that if this gets passed and approved and signed into law, that we will start to help fix the broken system, because we really shouldn't be having FDA approve and then CMS saying, well, let's also assess if, it should be covered.
You mentioned education is so important on, of course, every issue, but on healthcare, it can mean, the difference between life and death. What is the best way that you've seen communication on Alzheimer's disease to recognize early symptoms? Is that from the government? Is that on social media? Is that at the local community health centers? Well, what works to educate people? Because, this affects so many people, and until there's a cure, it's going to affect more people.
Well, I think it's an above all approach. All of those things you just mentioned. When you go to the doctor and you inquire, I think there should be education on that level. In Latino communities, we have something called promodoras, people who are out in the communities that people trust, right? It's that messaging. It's making sure that television, you always see commercials about, here are the signs for a stroke. Well, we could do the same thing on running a national campaign on, signs to see for Alzheimer's and dementia, and what to ask for, what kind of a test to ask for, as opposed to just asking somebody how they got dressed today. And so, we all can do our part. But, it's everything from PSA announcements to locally in the community. I think this is one of the things we're seeing how we can invest in not just funding, but outreach and community outreach might be something to look at as well.
My last question, what's a realistic goal for treating Alzheimer's long term? 5, 10 years, we're still searching for a cure for cancer, but obviously if treatments are available, cures, maybe investment's going to be worth it.
Well, every organization, Alzheimer's organization that we talk to and even constituents that ask this question, it's the same at the end of the day, and it's that we need major increases in federal funding to find a cure. And we need to make that investment. Just like we heard the president make the investment in cancer, Alzheimer affects millions of Americans. It's growing. I think it's one of every 9 Americans is impacted or affected by it. And it's a top, Alzheimer's disease is only a top 10 cause of death without a cure. So we have to do our part. Now, Congress has formally authorized the Advanced Research Projects Agency for Health, which is called ARPA-H, and increased funding by $500 million. But there's a lot of work to be done. And so we need to have members and constituents continue to reach out to support this effort to make sure we're getting the funding that is necessary. But then also having the government partner to say that when that treatment is found and when you have something that gets FDA approval, that we make it accessible. So it's definitely making sure that government is also working efficiently and as it's supposed to.
Congresswoman, thanks so much for joining us today.
Thank you for having me.